Assalamu alaikum. Assalamu alaikum, my dear students. Do you hear me clear?
Yes, ma'am.
Thank you so much. Marwa sir. So, how many participants are here? Let me see. Only 61.
61.
Shall we wait or shall we start?
You can start.
Okay. I am Dr. Asma Saadia, and today I'm going to start a new topic of general pathology, and that is inflammation. So what I'll be doing is that in the few 10-15 minutes, I'll be talking about inflammation in general, and then we'll concentrate on acute inflammation, right? So in the first slide, do you see an image, and what do you see in that image?
A redness on the toes.
Very good. It is left foot or right?
It's right.
Right. Very good.
Right.
And there's redness on the big toe as well as on
The
the
small toe.
third and fourth toes. Anything else in addition to redness?
Swelling.
Yes, very good. Please note them down. These findings, note your findings down on some paper so that we can discuss them in a few minutes. Right?
Yes.
So in this slide, can you see a red sign? What does it say?
On the truck.
No, the topmost, the yellow colored.
Danger, highly inflammable.
Highly flammable or highly inflammable. कहाँ पे देखते हैं आप ये sign? कभी देखा है?
Near petrol stations.
मैम ऑयल टैंकर्स के पीछे
ऑयल टैंकर पे भी लिखा हुआ है फ्लेमेबल और उसके ऊपर भी ये साइन बना हुआ है और हमने एक रेड कलर का भी साइन देखा है this actually sign is displayed mostly in labs in those areas where those materials, those chemicals are stored which can catch fire easily. Agree?
Yes.
सिर्फ मरवा जवाब दे रही है और कोई बच्चा क्यों नहीं जवाब दे रहा?
Yes.
You hear me?
Yes, ma'am.
यस
Yes,
मैम
Thank you so much. अब ये ऑयल टैंकर नजर आ रहा है इसके ऊपर क्या लिखा हुआ है? Flammable.
Flammable.
No smoking and maintain a safe distance. सड़क पे चलते हुए कितनी दफा ये ऑयल टैंकर आपने देखा है? बहुत दफा many times. और इसका मतलब क्या है? To make us cautious कि हम उससे एक safe distance maintain रखें, हम उसके करीब smoking ना हो. This reminds me of an incident that took place some 3 to 4 years back in Ramzan. In an area near Bahawalpur, an oil tanker started leaking. And the news spread just like fire. And the people from surrounding areas, they just came to get some oil, baltiyan, और जो जो उनके पास सामान था वो लेके आ गए और वल्लाहु आलम कोई सिगरेट पी रहा था या क्या हुआ that oil which was spread on the road and sideways that caught fire and many people they got burnt and many lost their lives. So ये एक dangerous situation होती है और इसीलिए लोगों को अलार्म करने के लिए flammable या inflammable और या highly flammable का sign हम display करते थे. So what about inflammation? This word is derived from Latin word inflammatio, meaning to set on fire. And this name is given to this condition because of the redness that can be seen on inflamed area and the warmth that is felt when we touch the inflamed area. So if we go about the definition, it is a response of vascularized tissues that delivers leukocytes and molecules of host defense from the circulation to the sites of infection and cell damage in order to eliminate the offending agent. I repeat, inflammation is a response of vascularized tissues that delivers leukocytes and molecules of host defense from the circulation to the sites of infection and cell damage in order to eliminate the offending agent. So this is a protective response that is essential for survival because it serves to rid the host of both the initial cause of cell injury, for example, microbes and toxins, and the consequences of such injury, for example, necrotic cells and tissues. So is inflammation always helpful? Is it always good? Is it always protective? No.
No.
Sometimes we see harmful effects of inflammation as well. And in those conditions, when inflammation is directed against self-antigens, autoimmune disorders, okay? Or inflammation is directed against, inflammatory response is generated against harmless environmental substances, for example, different types of allergies. Or when the inflammatory response does not subside after doing its function, it persists, it goes unchecked. In conditions where we see harmful effects of inflammation. And in those conditions, the inflammatory response becomes the cause of the disease, and the damage it causes becomes the major symptom. So this is a table that I've taken from your book, Robin's Pathology, and it shows the diseases caused by inflammatory reactions. The disorders can be acute or they can be chronic, and along with the disorders, the cells and molecules which are involved in injury are also mentioned. So among the acute disorders that are caused by inflammatory response, dysregulated inflammatory response are the acute respiratory distress syndrome, asthma, glomerulonephritis, and septic shock. And the chronic ones, they include arthritis, asthma, atherosclerosis, and pulmonary fibrosis. So अभी तक हमने ये बात की है कि although inflammation is a protective response, लेकिन sometimes हमें ये इसके harmful effects भी देखने को मिलते हैं. And that is the reason कि हमें इसके बारे में detailed knowledge होनी चाहिए. Clear?
Yes.
Azan?
Yes, ma'am.
Thank you. So this is a figure that is again taken from your book, Robin's Pathology, and it shows the sequence of events that take place in case of inflammatory reaction. Now, let me see if my cursor, yes. The dendritic cells, macrophages, and mast cells, these are the sentinel cells, and the job is to stay alert and guard against any insult to the body in the form of microbes or necrotic. When any of these insults occurs, like microbes attack while a necrotic tissue cell damage, they become activated and they release different mediators, including amines and cytokines. And these mediators then trigger the inflammatory response, which results in vascular and cellular events of inflammation. So the end result is elimination of the microbes or dead tissue, and whatever damage is caused during this process, it is repaired. This is what happens now. So we can memorize the sequence of events by remembering 5 R's. Number 1 is recognition of the noxious agent that is initiating stimulus for inflammation. ठीक है जी, सबसे पहले तो आपने recognize करना है ना किसी भी noxious agent को. Next is recruitment of leukocytes and plasma proteins in the tissue. Removal of the stimulus for inflammation mainly by phagocytic cells, which ingest and destroy microbes and the dead cells. सबसे पहले क्या हुआ, recognition of noxious agent, उसके बाद recruitment of leukocytes and plasma proteins into that area, or then is removal of the stimulus for inflammation mainly by phagocytic cells, which ingest and destroy microbes and dead cells, and regulation of the response is important for terminating the reaction when it has accomplished its purpose. This is so important. अगर वो terminate नहीं होगा, it will go unchecked, unabated. Repair consists of a series of events that heal damaged tissues. So these are 5 R's. Number 1, recognition of the noxious agent. Number 2, recruitment of leukocytes and plasma proteins into the area. Number 3, removal of the stimulus of inflammation. Number 4, regulation of the response. And 5th is repair. Yeah? Regarding the terminology, inflammation is denoted by adding suffix itis after the name of the body part. Okay, for example, tonsillitis is inflammation of the tonsils, appendicitis is inflammation of appendix, and arthritis is inflammation of the joints. Itis is actually a Greek word which means inflammation. So in the topmost this image, do you see my cursor?
Yes, ma'am.
Thank you. So ये cursor जहाँ पे मैं ला रही हूँ इसको आप देखो कि ये this is actually a case of tonsillitis. And what you can see here, क्या देख रहे हो? टॉन्सिल्स को क्या हुआ?
swollen,
They are
redness,
swollen, red, ठीक है?
membrane closed.
And sorry, मिनाहिल क्या कह रही हैं?
मैम टॉन्सिल्स के ऊपर मेम्ब्रेन आ जाती है ना?
Membrane भी आई हुई है,
tonsillitis में।
exactly, membrane भी आई हुई है. They are swollen and red, and we can see a membrane on this whitish something on the tonsils. Now, second image is that of appendix, in which the lumen is obstructed by a feculate, and the commensal microorganisms which are present within the appendix, they multiply and they cause inflammation there. And inflamed appendix is again red and swollen. Isn't it? है ना, red or
Yes,
swollen? Thank you. In the third image, what do you see?
पेनफुल भी होगी.
पेनफुल भी होगी, बिल्कुल होगी, पेनफुल भी होगी. जब तभी तो पता चला कि अपेंडिसाइटिस हुआ उसको. इन चीजों में हम अभी आते हैं, अभी एक और स्लाइड आएगी, उसमें हम ये बातें डिस्कस करते हैं. ठीक है जी. थर्ड इमेज में क्या नजर आ रहा है? हैंड है, इसमें क्या हुआ है?
joint swollen.
swollen.
वेरी गुड.
Swelling.
कौन सा जॉइंट स्वोलन है? द proximal interphalangeal joints of the second and third digit, है ना? They are swollen. और थोड़ा सा अगर आप देखो, थोड़ी सी इसकी डिस्कलरेशन भी है, थोड़ी रेडनेस, डस्की सा कलर इसका हुआ है. ठीक है. So with this, in this slide, we came to know that inflammation is denoted by adding suffix itis after the name of the body part of the organ. Tonsillitis is inflammation of tonsils. Appendicitis is inflammation of appendix, and arthritis. इसी तरह colitis and so on and so forth. आप इसको समझ. ठीक है. Now we come to the cardinal signs of inflammation. Cardinal sign का क्या मतलब होता है? Cardinal. Any guess? Fazan.
Related to heart.
Any other guess? Isha.
ma'am, prime, yeah, जो
Very good, very good. Cardinal sign means the major symptom, which is used by the clinician to come to a conclusion, to diagnose the disease. उसको हम cardinal sign of inflammation कहते हैं. ठीक है? So there are 5 cardinal signs of inflammation. Number 1 is pain, right? Number 2 is heat. 3 is redness. 4th is swelling, and 5th is loss of function. A Greek writer, जो ग्रीक लैंग्वेज है, उसमें पेन को क्या कहेंगे? डॉलर. हीट है कैलर, रेडनेस है रूबर, स्वेलिंग इज ट्यूमर, एंड लॉस ऑफ फंक्शन इज फंक्शनल लीजन. अब हमने पहली जो इतने इमेजेस हमने देखे, उसमें हमने क्या क्या देखा? We have seen redness, right? And we have seen swelling. हम इसको पैल्पेट नहीं कर सकते, वरना जो इन्फ्लेम्ड ऑर्गन होते हैं, अगर आप उसको पैल्पेट करो तो आपको वार्मथ फील होगी. ये सब केमिकल्स जो हैं, केमिकल मीडिएटर्स होते हैं इन्फ्लेमेशन के, उनकी वजह से ये सारा होता है. हम ये अभी 2 लेक्चर्स के बाद हम केमिकल मीडिएटर्स पढ़ेंगे, तो उसमें हम डिटेल से देखेंगे कि ये कार्डिनल साइंस ऑफ इन्फ्लेमेशन एक्चुअली किस किस साइटोकाइन की वजह से हो रहे हैं. ठीक है. अब जब इतनी इन्फ्लेमेशन होगी तो वहां पे पेन भी होता है. अभी जैसे हमने पिछली स्लाइड में देखा है कि वो जो जॉइंट्स इतने स्वोलन थे, उसमें ऑब्वियसली पेन भी था. और जब आप एक जगह आपको पेन हो रहा है और आपकी स्वेलिंग हुई है, तो ऑब्वियसली यू कैन नॉट मेक यूज ऑफ दैट ऑर्गन. ठीक है ना. जिनको आर्थराइटिस होता है, क्या वो अपने हाथ उसी तरह यूज करते हैं जिस तरह नॉर्मल लोग कर रहे हैं? नो, बिकॉज उनको उसको यूज तो करते हैं, उनको ज्यादा पेन होता है. दैट इज व्हाई. सो द कार्डिनल साइंस ऑफ इन्फ्लेमेशन आर 5: पेन, हीट, रेडनेस, स्वेलिंग एंड लॉस ऑफ फंक्शन. और अगर इसको हम ब्रीफ में कहें तो डॉलर, कैलर, रूबर, ट्यूमर एंड फंक्शनल लीजन. क्लियर? Any response, बच्चों?
Yes, ma'am.
Yes, ma'am.
So what about local and systemic inflammation? Local inflammation means that the inflammatory response is confined to the site of infection or tissue damage. Right? Even local reactions may have systemic manifestations. For example, fever in the setting of bacterial viral pharyngitis. ये हम लोगों ने experience किया कभी कि हमें tonsillitis है या हमें pharyngitis है and we are having fever.
Yes, ma'am. Tonsillitis
में तो fever होता है. Systemic manifestations है, लेकिन the predominant site of inflammation is tonsils or pharynx. In rare situations such as some disseminated bacterial infections, The inflammatory reaction is systemic and causes widespread pathologic abnormalities, जिसको हम sepsis कहते हैं, और हम ICU में अक्सर ये cases देखते होते हैं. Agree? Haika?
Yes, ma'am.
Yes,
Thank
ma'am.
Yes, ma'am.
So this is a table again taken from your book. मैं आपकी बुक से क्यों ले रही हूँ ये चीजें सारी? मैं कहीं और से क्यों नहीं ले रही? Any idea?
पढ़ना आसान है,
जी?
हमें याद रहे और पढ़ना आसान है.
याद रहे इसलिए कि when you open your books तो आपको चीजें familiarize हो, आपने देखी हुई हो ये टेबल्स, आपको ये ना लगे कि हम बिल्कुल फर्स्ट टाइम कोई चीज देखते हैं. ठीक है, इसीलिए मैं आपकी बुक से टेबल्स वगैरह लिए हुए और फिगर्स लिए हुए ताकि आप उनसे familiar हो जाए. So the difference between acute and chronic inflammation was originally based on the duration of the response, but now we know it's much more than that. So as the onset is concerned, in acute inflammation, the onset is fast, within minutes or hours. When chronic inflammation takes days to develop, right? Cellular infiltrate in case of acute inflammation consists mainly of neutrophils, while in chronic inflammation, the predominant cells are monocytes or macrophages and lymphocytes. यहाँ पे monocytes और macrophages के दरमियान slash है. What is the difference between them? Minahil, Isha.
Yes, ma'am.
Monocytes और macrophages में
Yes,
क्या
ma'am.
difference?
मैम जब मोनोसाइट जो है वो टिश्यूज को इन्वेट कर लेते हैं तो वो मैक्रोफेजेस हो जाते
Very good, brilliant.
Yes.
आप लोगों को तो सब कुछ आता है. ठीक है. Tissue injury and fibrosis is usually mild and self-limited in case of acute inflammation, while it is often severe and progressive in case of chronic inflammation. Local and systemic signs are prominent in case of acute inflammation. They are less pronounced in case of chronic inflammation. ठीक है जी, acute और chronic inflammation में difference न सिर्फ उनकी duration का है, ठीक है, बल्कि cellular infiltrate, tissue injury and fibrosis, local और systemic signs का भी difference है. आगे move करें.
Yes.
हरीन, आगे move करें.
Yes.
Yes, ma'am.
Thank you. So what causes inflammation? Inflammation can be caused by a variety of stimuli, Some of these causes I have mentioned in this table. The most common cause of inflammation is the infection by viruses, bacteria, fungi, or protozoa. Most common cause. Different types of microorganisms inside different types of inflammatory response. Okay? Bacteria, acute inflammation करेंगे, viruses, they produce chronic inflammation. And at one end of spectrum, we have a mild inflammation that gets rid of the microbe promptly and then subsides. But on the other hand, we have a severe inflammatory response, which is known as severe inflammatory response, जिसको SIRS है. ठीक है ना, वो हो जाता है. इसके अलावा कुछ chemical agents like poisons and toxins, they can cause acute inflammation. Physical agents, trauma always incites inflammation, and the cells, they can die due to ischemia, for example, in myocardial infarction, or they can die because of trauma or because of some physical or chemical agents, for example, thermal injury or frostbite. These are the examples, and obviously they are associated with inflammation. Immune reactions, when they are directed against the self-antigens, are known as autoimmune diseases, and sometimes immune response to foreign tissues like allergens, as I have discussed with you earlier. So उनको immune reactions कहते हैं, and see more in chronic inflammation. So because can you get rid of self-antigens against which the immune response is directed, or the environmental substances against which? No, we cannot. So there is persistence of the inflammatory response. So usually we see chronic inflammation in those conditions. ठीक है ना? जैसे asthma है, that's chronic. Acute and chronic वो एकदम वो aggravate होगा, but a chronic process goes on. ठीक है, इसीलिए हमने foreign body का मैंने जिक्र नहीं किया. Foreign body, for example, splinter, dust, or suture, that can incite the immune response either because of itself or because it is contaminated. उसके ऊपर microbes हैं, उसकी वजह से inflammation cause करेगा. So the causes of inflammation are diverse. The most common causes are the infections, and other causes, for example, tissue damage, trauma, poisons, toxins, thermal injury, and autoimmune disease. These are all causes of inflammation. Now, coming to acute inflammation. Acute inflammation has three major components. Number one is dilation of small vessels, leading to an increase in blood flow. Number two, increased permeability of the microvasculature, enabling plasma proteins and leukocytes to leave the circulation. And the third is integration of leukocytes from the microcirculation, their accumulation in the focus of injury, and their activation to eliminate the offending agent. So the first two components, they are the vascular component. And the third one is the cellular component of acute inflammation. Today, we'll be dealing with only the vascular component or vascular events that take place during acute inflammation. And tomorrow, inshallah, we'll discuss the cellular events that take place during the inflammation. और इसके साथ ही एक अनाउंसमेंट है कि कल पैथोलॉजी का लेक्चर जो है वो सुबह 9 बजे वाला होगा, ठीक है ना? और जो फार्मा का लेक्चर दैट विल बी ऑन दिस टाइम, जो पैथोलॉजी वाला टाइम था, बिकॉज एक इंपॉर्टेंट मीटिंग आ गई है जिसको अटेंड करना है, तो उस वजह से हमने अपने चेंज कर दिए टाइमिंग्स. तो साद, हरीन, ईशा, tomorrow the pathology lecture will be at 9 o'clock and the second lecture will be that of pharmacology. So
Yes, ma'am.
Thank you. Acute inflammation has three major components: dilation of small vessels, increased permeability of microvasculature, these are the vascular events, and immigration of leukocytes from microcirculation to the focus of injury, and their activation to eliminate the offending agent is the cellular event, and tomorrow we'll discuss the cellular events. So the role of blood vessels in acute inflammation, the vascular reactions of acute inflammation consist of changes in the flow of blood and the permeability of vessels, both designed to maximize the movement of plasma proteins and leukocytes out of the circulation into the site of infection or injury. Okay? The purpose of vascular reactions of acute inflammation is to maximize the movement of plasma proteins and leukocytes out of the circulation and into the site of infection or injury. The escape of fluid, proteins, and blood cells from the vascular system into the interstitial tissue or body cavities is known as exudation. Clear?
Yes, ma'am.
Yes, ma'am.
So, this figure, again from your book, it shows what happens normally within the microvasculature and what is exudate and what is transudate. So let's concentrate on the A part, which is what happens normally. At the arteriolar end of the capillary, the hydrostatic pressure pushes the fluid out into the interstitium. जी हरीम.
मैम आपकी आवाज बहुत कट रही है.
आवाज? Okay, check कर लेते हैं हम लोग.
Okay, ma'am.
Do you hear me now?
Yes, ma'am.
Yes, ma'am.
Thank you. So normally what happens is that, these are the endothelial cells and they're lining the vessels beautifully with no gaps in them, between them. So this is what happens normally. At the arteriolar end of the capillary, the hydrostatic pressure pushes the fluid out into the interstitium, which percolates through the interstitium, and at the venular end of the capillary, the colloid osmotic pressure, which is mainly exerted by the plasma proteins, pulls the fluid back into the circulation. At the arteriolar end, the net movement of fluid is outwards, while at the venular end of the capillary, the net movement is inwards. The fluid that left the vascular compartment comes back into the vasculature through colloid osmotic pressure. Little fluid that remains within the interstitium is taken care of by the lymphatics, which take that fluid away and ultimately into the venous system. Now, in inflammation, what happens is that there is the gaps between the endothelial cells, interendothelial gaps, they are widened. Okay, they are widened, and they allow the fluid, the plasma proteins, and the cell to leave the circulation, and go out into the interstitium. ये जो blue नजर आ रहा है, this accumulation of fluid. What is edema? ये हम जब पढ़ेंगे हेमोडायनामिक डिसऑर्डर तो उसमें हम डिटेल में पढ़ेंगे, बट आप लोग फिजियो में ये पढ़ के आए हो कि edema is accumulation, increased accumulation of fluid within the interstitium. So exudate is seen in inflammatory process when the interendothelial gaps are widened and fluid having high protein content and some white cells and red cells leaks into the interstitium. And this is favored by vasodilation and stasis and increased interendothelial space. while transudate is just an ultrafiltrate of plasma. This can happen in case of venous outflow obstruction or congestive cardiac failure when at the arterial end of the capillary, the hydrostatic pressure is increased. It pushes the fluid out into the interstitium, although the gaps are not there between the endothelial cells. No gaps are there. There's just an ultrafiltrate of plasma. Or it can happen in conditions where reduced protein synthesis, for example, in liver disease, or increased protein loss, for example, renal diseases, or in case of protein losing enteropathy, glomerulonephritis, in which we lose proteins and ultimately hypoalbuminemia results. The hydrostatic pressure is increased. It pushes the fluid into the interstitial spaces, or in case of hypoproteinemia, the fluid that has leaked into the interstitium does not come back into the circulation because of low plasma polar osmotic pressure. And the result is increased accumulation of fluid within the interstitium, this blue. So the basic difference between exudate and transudate is that exudate is seen in case of inflammatory reactions. It has a high protein content and may contain some white cells and red cells. While transudate is just an ultrafiltrate of plasma, it has low protein content and a very few cells. It is seen in conditions in which hydrostatic pressure increase, for example, venous outflow obstruction or congestive cardiac failure, or in conditions in which there is hypoalbuminemia. You know, polar osmotic pressure is mainly exerted due to albumin. ठीक है? तो जब hypoalbuminemia होगा, तो there will be decreased polar osmotic pressure, and the fluid that has leaked into the interstitium cannot come back, cannot be pulled back into the circulation. So this is exudate versus transudate. I hope it's clear. Hari?
Yes,
Yes,
ma'am.
ma'am.
Thank you. So the changes that we see in acute inflammation in vascular flow and caliber consist of vasodilation. It occurs very rapidly during the acute inflammation, or there is increased permeability of the microvasculature. ये हम अगली slide में भी आके देख लेते हैं. So the result of vasodilation and increased permeability of microvasculature is that fluid and plasma proteins, they leak into the interstitium. The result is increased viscosity of the blood and stasis. Stasis, ठीक है ना? That is the reason for the redness. Increased blood flow and stasis, that is the result of redness in the inflamed area. Blood leukocytes, principally neutrophils, accumulate along the vascular endothelium. At the same time, endothelial cells are activated by mediators produced at the site of infection and tissue damage and express increased levels of adhesion molecules. Again, ये जो cellular element है, ये हम इंशाल्लाह कल discuss करेंगे. So जो vascular flow और caliber में changes है, this is vasodilatation, increased blood flow to the area where the inflammation is taking place, and increased permeability of the microvasculature, which leads to stasis of blood at the site of inflammation. The increased permeability or vascular leakage is the result of two things. Number one, contraction of endothelial cells, which is brought about by histamine, bradykinin, leukotrienes, and this is the immediate transient response. The endothelial cells, they contract. जब वो contract करेंगे तो उनके दरमियान में gaps widened हो जाएंगे. Initially there are no gaps, small gap होगा अगर होगा भी. तो जब ये contract होंगे, तो gaps will be formed, which will lead to vascular leakage or endothelial injury resulting in endothelial cell necrosis and detachment, which can be seen in case of thermal burns, microbes and microbial toxins, and even neutrophils that attach to the endothelial cells. They can also damage the endothelial cells in case of infection or inflammation. ठीक है जी, vascular leakage, increased vascular permeability can be the result of two things. Number one, contraction of endothelial cells brought about by histamine, bradykinin, leukotrienes. This is the immediate transient response. Or it can follow endothelial injury resulting from endothelial cell necrosis and detachment, as we see in thermal burns, microbes and microbial toxins, and even neutrophils can damage the endothelial cells. This figure shows beautifully placed lining endothelial cells. ठीक है, इनके दरमियान में कोई gaps नहीं है, and there's confinement of the leukocytes and plasma proteins within the circulation. This is what happens normally. But sometimes there is contraction or retraction of the endothelial cells and resulting widening of the interendothelial gaps. This results in leakage of plasma proteins and leukocytes into the interstitium. Sometimes endothelial cells are damaged, for example, by thermal injury or by neutrophils and microbial toxins. They are damaged by microbial toxins as well. It is usually rapid, but maybe long-lived, hours to days. And these damaged endothelial cells obviously cannot hold back the proteins and the cellular elements, and ultimately they leak into the interstitium. यहाँ तक clear हो गया जी?
Yes, ma'am.
Yes, ma'am.
Thank you. Response of lymphatic vessels and lymph nodes. What is the function of lymphatics? अभी हमने बात की. Lymphatics drain the small amount of extravascular fluid that seeps out of the capillaries in the healthy state. जब हमने normal fluid balance की बात की थी तो हमने कहा था कि at the arteriolar end the net movement is outward, and at the venular end of capillaries the net movement of fluid is inwards. Whatever little amount of fluid that remains within the interstitium is taken up by the lymphatics. Lymphatic vessels, like blood vessels, proliferate during the inflammatory reaction to handle the increased load. हमने नीचे की दो figures में ये देखा था कि there is seepage or leakage of the fluid into the interstitium in case of inflammation. ठीक है? So the workload of lymphatics is increased. The lymphatics may become secondarily inflamed, which is called lymphangitis, as may the draining lymph nodes, lymphadenitis. Inflamed lymph nodes are often enlarged because of hyperplasia of the lymphoid follicles and increased number of lymphocytes and macrophages, which is called reactive inflammatory lymphadenitis. आप लोगों में से कितने लोगों ने ये experience किया है कि whenever we get tonsillitis or pharyngitis, तो हमारी जुगलो digastric lymph node होती है वो painful और palpable हो जाती है. और या किसी और पेशेंट में देखा होगा जिसका chronic ear infection चल रहा है, उनकी post auricular lymph nodes they become palpable. आपने किसी ने experience किया इस चीज को?
Yes, ma'am.
Yes, ma'am.
It's a common finding. It's a common finding. ठीक है ना? हम देखते हैं कि जुगलो digastric node हमारी palpable होती है. वो इसलिए होता है कि that lymph node is draining the tonsils and the pharynx. So drainage area की जो lymph nodes होंगे they become enlarged and palpable. They can get infected as well. वो involve हो सकती है जिसको lymphadenitis कहते हैं, but usually this is reactive inflammatory lymphadenitis. वो reaction चाहिए because उनका workload increase हो गया lymphatics का. They have to take care of a large amount of fluid that seeps out of the vessels. ठीक है जी? So the content जो भी मैंने आज आपके सामने present किया that is taken from Robinson Pathology Base of Disease 10th edition. ठीक है? यहाँ पे हमारा आज का लेक्चर खत्म होता है. If you people have any question, any query, I'll be more than happy to answer.
मैम एक्यूट और ट्रांसक्यूट में हमारा जो एपिथेलियल परमेबिलिटी है वो दोनों.
बेटे प्लीज आप थोड़ा ऊंचा बोलिए. I cannot hear you properly. कौन बात कर रहा है? फाइका?
मैम एक्यूट और ट्रांसक्यूट
का डिफरेंस?
नहीं मैम, उसमें हमारे पास वास्कुलर परमेबिलिटी एक कितनी होगी?
इंक्रीज हुई है ना. एक्सुडेट में वास्कुलर परमेबिलिटी इज इंक्रीज because of contraction of the endothelial cells or because of the damage of the endothelial cells.
और मैम
Transudate when there is no breach in the continuity of endothelial cells. There is no breach. It's just because of the increased hydrostatic pressure, the fluid pushed out of the vessels. ठीक है ना? और या जो fluid that leaks out of the vessels cannot come back because of reduced polar osmotic pressure. ठीक है ना? किन conditions में जहाँ पे हमारी hypoalbuminemia हो गई या तो albumin बानी कम रही है, for example in liver disease, or it is lost in urine or in stool, for example kidney diseases, or in cases of protein losing enteropathy. So transudate is just an ultrafiltrate of plasma. It has a very low protein content and a very few cells. जबकि exudate is a protein rich fluid. So protein rich fluid और उसके अंदर red cells भी हो सकते हैं और WBCs भी हो सकते हैं. ठीक है? So basically the accumulation of fluid, increased accumulation of fluid within the interstitial tissue is known as edema. और edema में आपके पास exudate भी हो सकता है और transudate. Clear?
Yes, ma'am.
Thank you. Any other query? और ये भी हो सकता है कि आप घर जाके इसको घर में तो है ही खैर, आप इसको लेक्चर्स के बाद पढ़ें और उसके बाद अगर कोई क्वेश्चंस हैं तो हम कल इंशाल्लाह उन क्वेश्चंस को एड्रेस कर लेंगे. राइट? और कल क्लास हमारी किस वक्त है?
ओके मैम.
हमारी क्लास कल
9 बजे.
9 o'clock. ठीक है? So tomorrow we'll be discussing, inshallah, the cellular events that take place in acute inflammation. Thank you very much. Allah Hafiz.
Allah
Allah
Hafiz.